we undertook a major market survey, market research, to find out how people use pharmacy. Older men in particular didn't go to pharmacy for any sort of health service other than collection of prescriptions. The difficult group, the ones who don't use pharmacy, are younger men. Pharmacy provides a lot of services, and we know about things like stop smoking services, weight management services, albeit patchy, not in every PCT, not in every pharmacy. We have seen people like Lloyd's Pharmacy. They've done some fantastic work working with football clubs, so going to Aston Villa, going to Birmingham City, to do health checks. So the NHS health check, cholesterol, blood pressure, blood glucose, full comprehensive health check. 20 or 30,000 men on a Saturday afternoon, and people were clamouring for it, so there is a need. So one action is promote the role of pharmacy, promote the use of pharmacy as somewhere people go for health messages and supporting healthy lifestyles. The other action, and probably the bigger challenge, is to work with commissioners, so PCTs, and work with pharmacists to get them to take on the wider roles.
Thank you very much. Big hand for Jonathan. Excellent. What about the pharmacists? We now know the pharmacists are obviously a great resource, and that men will now be flocking to the doors of the pharmacist to actually to get some advice and some medicines maybe. But Jonathan, when you opened your spam box just the other day, and you had a look at what rubbish was in there, what did you find most in your spam box?
Viagra.
Viagra, that's it?
Yes,
okay, now.
It's the prime one.
Right, now, did you know that only 1 out of 10 tablets of Viagra are actually made by Pfizer? Yeah? And all the rest are counterfeit, right? Now, the average delay for men being diagnosed with diabetes in the UK is around about 10 years. For women, it's around about 1 year, 1 to 2 years, okay? Now, the single biggest cause of erectile dysfunction is diabetes. Second was cardiovascular disease, and then hypertension. Now, I put it to you, Jonathan, that if men are going to open their spam box and they're going to see, hey, look at this, all they're going to go is dink and put a credit card number in, the Viagra comes out through the letterbox. Instead, of course, having to go to the pharmacist and having to see a doctor with the script, and of course the pharmacist comes out and says, Mr. Smith, I've got your Viagra here for you, in front of all of what is normally women in there as well. I just wonder, do you think something like Viagra should be easier for men to buy through, for instance, a POM to P shift for Viagra into the pharmacy? I know it's difficult for you to speak on this one, coming from where you're coming from, but is there a logic behind that, do you think?
Maybe not Viagra itself, but the other products within the range of treatments for erectile dysfunction. Why not see those going POM to P? Well,
this is the kind of debate we want to hear, because really the WHO is forecasting an epidemic of undiagnosed diabetes in men simply because of this problem. This is serious stuff that we're talking about. Any comments from we have any pharmacy-related people in the audience at all?
What can pharmacies do both to engage with men, young men in particular, on sexual health issues, and also how could pharmacies play a role in having greater discussions around responsibilities between men and women, responsibilities between partners on these issues, including Viagra for that matter?
With regard to responsibilities, particularly around sexual health, where we have a number of schemes now in place looking at things like chlamydia screening, there is great encouragement of young women in particular to bring their partners in for a discussion about sexual health. So I think we're starting to get those dialogues going, and I think we need to build on that much further.
The immediate reaction to the Viagra in your spam box is to say it's terrible and we must stop spam. But you'll never actually stop that spam. And I think what's much better is actually to raise the level of awareness so that men, and even blue-collar men, behave as adults, and they realise that 90% of it is fake. And we signpost them to better services through pharmacies and GPs and NHS Direct and things like that, so that they get the problem sorted out at source. So actually it's about raising the level of awareness and understanding so they can be informed consumers.
Sounds reasonable. Which brings me, of course, to Phil Hilton, former editor of Men's Health magazine, of Nuts, of Later, I don't want you to feel as though you're on trial here, Phil. All right?
Finally
I don't want you feeling as that it was your fault that the basket, came down and killed all of you. I really don't want you feeling that.
I haven't even heard what I'm saying.
All right? Now, does 50 boobiest blondes really help men's health, do you think? That's number one. And here we have, that's Men's Fitness. Oh, that's the same company. It tells me how to survive an elephant attack.
There you are.
There it is.
Practical everyday advice here. That's what we do.
Is this trivia valuable to men's health?
I think, first of all, it's fair to say that editors are often portrayed as kind of amoral, shallow drunks, barely holding their lives together, and I can tell you that's true. But the point I'm about to make, though, is that there aren't very many of them, which is a huge advantage when trying to have a major influence on behaviours. There are very, very few editors in this country, and you can engage them directly. So I'm proposing an editors' health club in which we challenge the editors of Britain to do something in their own lives. And you will find, because my colleagues are all attention-seeking egomaniacs willing to climb into balloony baskets for no good reason, that they will blog about these, they will write about these changes. If you get them to take their alcohol down, get them to do a little exercise, who knows, anything's possible. There'll be massive publicity if you engage directly with them.